Hi, my name is Amanda.
I'm Sam.
I'm Nisa.
I'm Sydney.
And I'm Shabarsky.
And we'll be talking about sleep and the older population.
Okay, so I'm going to talk to you about why sleep is important. Sleep is important for everyone, especially for older adults. It helps your body to repair cell damage. It can improve memory, concentration. It also can help you with functions throughout your day. These are some sleep myths that older adults have. The older I get, the less sleep I need. That's obviously not true. Once you reach adulthood, your sleep requirements remain the same. My nighttime routine doesn't need to change just because I'm getting older. As we age, we tend to sleep lighter and are more easily awakened. Things such as medications, pain, certain diseases like arthritis can cause pain, making it difficult to sleep at night, and environmental factors can make it more difficult to stay asleep, requiring modifications.
So, as we get older, we experience some sleep changes. According to a 2003 survey, about 67% of older adults said that they experience 1 to 2 sleep changes during their normal sleep patterns. So some sleep disorders in older adults are insomnia, sleep apnea, RLS, periodic limb movement, circadian rhythm sleep disorder, and REM behavior disorders. So insomnia is one of the most common sleep complaints at any age, and it affects almost half of all older adults 60 and over. If you have insomnia, you may experience some of the symptoms below, which are taking a long time, about 30 to 45 minutes to fall asleep, waking up many times each night, waking up early and being unstable to get back to sleep, or waking up feeling tired. Another sleep disorder is sleep apnea. Sleep apnea and snoring are 2 examples of sleep-disordered breathing, and these conditions make it more difficult to breathe during sleep, and they can cause people to wake up often at night and be drowsy during the day. Snoring is a very common condition affecting nearly 40% of the adult population, and it is more common among older adults and people who are overweight.
Next sleep disorder that we have is restless leg syndrome. The main symptom is a nearly irresistible urge to move the leg. People may experience pain in the leg, sleep difficulties, excessive daytime sleepiness, sleep deprivation, or sleep disturbances. With the whole body, you may just feel fatigue or even more restlessness. And even what's also more common is leg cramps, uncomfortable tingling, and burning, and that's because your leg is continuously moving, especially when you're sleeping, so it's uncontrollable and you may get cramps. The next sleep disorder that we have is periodic limb movement. The exact cause of this disorder is unknown. Several medications are known to make this worse, however. So medications that are antidepressants, antihistamines, or even some antipsychotics can make this condition even worse. Most patients aren't aware that they're doing this when they're sleeping. It's more commonly reported by their bed partner. So most of the limb jerks are often reported by their partner, and they don't really know that they're doing it. Patients experience frequent awakenings from sleep, non-restorative sleep, daytime fatigue, and or daytime sleepiness because they're not getting the proper rest that they need to get. The next we have is circadian rhythm sleep disorder. So this is the abnormalities in the length of time that you're sleeping and the rigidity of the sleep-wake cycle relative to the day-night cycle. You may have difficulty going to sleep. You may have difficulty maintaining that sleep if you do happen to go to sleep. Impaired performance, including a decrease in cognitive skills, as well as poor concentration, daytime sleepiness, and non-restorative sleep. Now here we have REM sleep disorder, REM sleep behavior. REM sleep behavior disorder is a parasomnia. A parasomnia involves undesired events that happen while sleeping. So something that's relevant to this is such as night terrors. So these dreams are often filled with action, so you're moving and it feels very real. They may be violent as well. Episodes tend to get worse over time. Early episodes may involve mild activity. Later episodes can be more violent. And this disorder can be ignored for years. At some point, it is likely to result in an injury because you may be acting out what you're doing in your dreams. And they also said that it can be violent, so you may be acting out some violent actions. So either the person dreaming or the bed partner may be hurt because of the REM sleep behavior.
Okay, so we just talked about a number of different sleep disorders and reasons why it's difficult to fall asleep. Now I'm going to talk about some different tips to improve your sleep. So these are to be engaged, to exercise often, to limit your screen time, to limit caffeine, and to have a good sleep environment. So exercise often. So exercise releases endorphins that can help reduce stress, anxiety, and depression. And these are all things that a lot of older adults can suffer from that can help you sleep better at night. So according to a study, getting 150 hours of moderate exercise per week can help reduce leg cramps at night and provide important sleep quality. There was also another study done in a medical institute in which they had a number of participants and they divided them into two groups. So the first group was the control study, and they basically, they just went on with their normal daily activities. They didn't do anything out of the ordinary, and they had largely sedentary lifestyles. The second group, they had exercised about 30 minutes of moderate intensity exercise per week, about 4 times per week. So at the end of the 16 weeks, they found that the group that exercised more often had better sleep quality, sleep duration, and also they were able to, they didn't fall asleep as often throughout the day. So exercise is extremely important. They also did another study that found that yoga has been shown to have a beneficial effect on sleep. And also lastly, to stay socially engaged. So being able to go out with your friends and family, having a hobby, volunteering, all these things can keep you mentally stimulated. So when night comes, you're able to have a more restful sleep and you're more tired. Okay, limiting screen time. So you want to avoid using screens at things like your laptop, your computer, your cell phone, your iPad, all these, your television in your room, all these things can limit you from getting asleep. They did a study that showed that light-emitting screens can suppress melatonin production. So by having a bright light in your face, melatonin is a hormone that regulates your sleep-wake cycle. So this is actually a hindrance to falling asleep. So make sure you turn off those things. And if you do want to do something while you're in bed, make sure it's either reading a book, a paperback book, or something like a Kindle that has a matte screen so there's no light emitting into your face. Also try listening to music. Relaxing or classical music or reading are all things that you can do that can help you get a more restful night's sleep. Okay, next is limiting caffeine and fluid intake before bed. So this is a common complaint among older adults that they often have to wake up multiple times throughout the night to get up to use the bathroom. So one way to help with this is just simply to limit fluid intake an hour or two before bed. So just simply stopping drinking fluids. Also limiting caffeine, alcohol, and nicotine, which can all impair sleep quality. So alcohol is actually a depressant. So basically the way that works is you can have a glass of wine maybe before bed, but then typically it'll help you fall asleep, but then usually in the middle of the night it can actually cause you to wake up and have a difficult time falling back asleep once the depressant actually wears off. And caffeine and nicotine are actually stimulants, so they keep you awake and make it harder for you to actually fall asleep at night. So in summary, just try and avoid drinking any type of fluids and avoid any type of caffeine, nicotine, or alcohol after 4 p.m. Okay, and improving your sleep environment. So you want to make your sleep environment as comfortable as possible. So this is often an aspect that is overlooked. So you want to make sure that your room is comfortable and quiet in your bedroom. So if you live in a noisy neighborhood or you have a sleep partner that snores at night, something you can do is get something like a noisemaker. And basically what this is just, you can plug it into the wall and it emits a white noise, so it blocks out noise on the street or someone snoring. You can also use something like earplugs. And then also make sure that you have a supportive mattress and pillow. So if your mattress isn't supportive or your pillow is not supportive, you're not going to get a good restful night's sleep. So you want to make sure that you're replacing your mattress between every 5 to 10 years and your pillow more often, They say around 18 to 36 months. So you want to make sure that your pillow and your mattress are nice and supportive. That way you're not waking up in the morning having increased aches and pains. And lastly, make sure that your room is dark and cool. So something that can help with keeping the room dark is just an eye mask that you can use to help keep the room nice and dark at night if you have light coming in your room. Or you can get something like blackout curtains, which can help make your room nice and dark. And then make sure that your room is cool. And this is something that varies from person to person, your personal preference. But you want to make sure that your room is on the cooler side. That way it creates a better sleep environment.
Okay, so our next focus is on non-pharmaceutical ways to sleep. A lot of older adults take sleeping pills in order to fall asleep, and when you take sleeping pills to fall asleep, you're not getting into that deep REM sleep. You're just putting yourself to sleep, not getting those deep waves to your brain. Deep sleep is what allows us, our memories, to go from short-term memory to long-term memory. So if you're not getting into that deep sleep, you're not able to form memories and keep memories in your long-term memory. You can use things like the white noise machine, and you can also use a form of non-pharmaceutical way to the alpha stim machine. The alpha stim is electrical stimulation that works on enhancing your brain waves. It's a cranial electrotherapy stimulation. It increases your sleep time, reduces sleep disturbances, and improves overall sleep quality. Sleeplessness starts in your brain where electrochemicals, they're called neurotransmitters. They control whether we are awake or whether we're asleep. During normal sleep cycles, neurons at the base of the brain begin signaling when we fall asleep, and they switch off the things that keep us awake. When these neurotransmitters become unbalanced, we have a harder time falling into a deep sleep. The alpha stim treatment for insomnia safely modulates the brain's electrochemical signals, bringing the signals back into balance with electrotherapy. After a study, there was a study they did where the number of subjects rated their sleep as poor in the beginning, and that was 60% of people rated it poor, and at the end of the therapy, only 5% of people rated their sleep as poor. They also did another study where after only 5 treatments, military service members with insomnia reported an increase of 43 minutes of sleep per night. I'm going to have to pause it because I forget what we said at the end. In summary, sleep is very important to make sure that you follow the tips that we provided throughout this presentation. If for whatever reason these tips don't help, make sure you see a doctor to make sure you're getting quality sleep to provide you with a great rest of your day.
Have a good night's sleep.